here in Salt Lake City. Going to be meeting with Dr. Weitzel tomorrow from Beyond Institute to explore MDMA. So MDMA is a medication that was actually discovered in 1912 by a German scientist, and then Merck purchased it in 1914. I think it was they were trying to find a medication for blood clotting, and then they realized that this medication maybe wasn't so good for that, but it did help with had some psychological effects. And I don't think it was used for a whole lot for many years, but then somewhere in the late 60s and 70s, some psychiatrists started using it. They realized that when they gave this medication to their patients in therapy, that they were much more open and they were sharing more and they had a lot more insight, and their therapy seemed to progress and be much more effective. Unfortunately, the medicine also got into the hands of some people who wanted to party and use it, and they started using it in clubs and dancing, these raves. You may have heard of it called ecstasy or Molly, and there were also some problems with it. I think it was, if someone uses it and they get overheated, they can have a problem with it. So it wasn't really dangerous, but there were some problems. So somewhere in the early 80s, it was put on the Schedule I list and outlawed. So it went underground. Some therapists were still using it, and of course, like most illegal drugs, people were still using it. But up until that point, it hadn't been Schedule I or illegal. And then in there was a brief time in the 80s, I think they tried to do some studies. In the later 80s, they tried to do some studies and it didn't go very far. But MAPS, the Multidisciplinary Association for Psychedelic Studies, has been looking to do some research with it, and they started a couple years ago doing some studies with PTSD and using MDMA, and the results have been astounding. Like 67% of people who have gone through the study no longer meet the criteria for PTSD. And given the typical therapies that we have, which have maybe a statistical improvement of about maybe 20%, this 67% is so much better. And so I've had my challenges with PTSD, and I've used a variety of therapies, typical SSRIs and medicines in that class, and then some different types of therapies, tapping, EMDR, and some work around the trauma. And I can say it's definitely been effective, but I was very curious about learning about this medicine for myself and for my patients that ask me. I like to try things out myself. Not sure if that's a good idea or not. But so here I am. I found a doctor. I actually looked into being in the study, but I didn't qualify for the study, partially because I'm not currently using any of those medicines, and you really almost have to be using them and failing those medicines to be in the study. So Dr. Weitzel here at the Beyond Institute does provide this therapy, and I'm going to be talking to him later today and sharing that with you, and then also sharing what my experience is like using this medicine. So I'll see you soon. I'm here with Robert, Dr. Weitzel. Am I saying that? Weitzel.
It's German. Herr Dr. Weitzel, yeah.
Okay, from the Beyond Institute, and we're going to be. He's going to be helping me with the MDMA tomorrow or the next day. So I just wanted to talk a little bit about what your experience has been like with this medicine and how you started using it with
Well,
patients.
we started out with psilocybin, and I learned more about how MDMA can be really useful for trauma and just general growth. People do have the Beyond experience with it, but many people have said to me that it turbocharges therapy, and I have experimented with it myself in a therapeutic manner, and found it very, very eye-opening, revelatory. And we often have we've had folks come who had a lot of trauma for psilocybin, and they'd be caught up in a fear loop at first. They'd be, their ego wouldn't let go, and they'd be full of fear. Often after they get over the peak, their ego is exhausted by then, and they do go into that mystical state. But I found that using MDMA first can really help that a lot. And then if they want to try psilocybin afterwards, often people will come to town and do MDMA one day and then the psilocybin the next.
Yeah, it's a lot of work to do in 2 days.
Well, for me, it's not so much work. I'm sitting around a lot, especially with psilocybin. But for me, I found psychiatry to be work, and this is such a joy to participate in.
And you've been doing it for how long?
Well, we started Beyond Institute at the first of last year.
Okay.
But I'd been working with the entheogens before that. I'd been practicing psychiatry and seeing how often people are misdiagnosed in psychiatry and put on pharmaceuticals, often polypharmacy, to no good end. More side effects than benefit. And I also realized that so many people by psychiatrists are misdiagnosed with something that requires a pill, rather than treating a trauma of some sort, be it developmental or single issue. People get called everything from borderline personality to schizoaffective, bipolar type 2, and then you get started on a serotonin reuptake inhibitor, and then it's Adderall.
Then you need a sleeping pill.
Oh yeah, and then got to have your mood stabilizer, and of course they're always psychotic, so they need that too. And for long they got diabetes and can't have sex, and it's just what's life for? When there have been treatments for trauma, and the understanding of trauma has really come a long way. With therapies like EMDR and somatic therapies and mindfulness, but then now we have entheogens, or psychedelics, and I tried those when I was a kid, and wrong setting, and the so-called bad trip. To me, that's a panic attack while you're on a psychedelic, and it doesn't go well, and it can be a re-traumatization almost, or an initial. And so I kind of avoided that with college and medical school and there, and on. But I started reading about how helpful it is for people, and my stepdaughter had some good shrooms and tried that, and I had my first Beyond experience. I was lying in bed talking to somebody, and each word started coming out slower and slower until time stopped and the words stopped. It was incredible. So
once you had that experience.
You know what the elephant is. Do you know that story?
About what you're
man,
describing the elephant,
the blind man and the
right?
elephant? Suddenly a lot of things become clear. I worked with that a little bit, and then actually worked with some clients who really needed it, and they improved, and our group got together, friends and people I knew in the community, and we worked with each other with 7 grams of psilocybin.
That's a pretty big dose.
That's the heroic dose. And, well, on my occasion, I'll tell you about that, I was out of it for 2 hours. I don't remember that 2 hours. And my sitter, Sally, when I came to, said, who's been talking to you for the last 2 hours? You kept talking to someone, and you'd say, just lying there, eyes closed.
But you don't remember who you were talking to?
I don't remember a bit of it. She said I'd be going, oh yeah, now I see. And got a real download. It felt different after, but we did just psilocybin at first, and because, well, I'll continue the story. I got involved with the Native American Church. I was invited by a friend to peyote ceremony, and after a while, since I was a medical doctor, I had a lot of knowledge of pharmacology, things like contraindications for medicines, and I started teaching them as well as them teaching me. So we cross-fertilized like that, and after a couple of years they may be a medicine person. So that allows me to operate above ground. I left medicine, voluntarily relinquished my medical license, and that way I can't get charged with some kind of medical malpractice or something by the boards. Soon this medicine will be legal, but right now we're able to furnish it to folks who are appropriate in a safe way, and hopefully efficaciously usher them into the beyond.
Yeah. Well, I'm excited to try this out and share that with you. My MDMA experience with Dr. Weitzel at the Beyond Institute, and I wanted to share with you what that was like and what it has been like since then. So my experience started at about 8 o'clock in the morning. Dr. Weitzel came and spent about 30 minutes talking with me about what I was hoping to get out of it, and then he dissolved my first dose. It was 125 milligrams of MDMA in a glass of water, and I drank it. I really didn't taste anything. It tasted like water. And he also had a assistant there with him, Brittany, and my good friend Kim was also there. So I had 3 people there with me. I went to the other room and I laid down. I had the MDMA, the MAPS protocols, soundtrack that I was listening to in headphones, and I had an eye mask on, and so I just laid down and waited for the medicine to take effect. I didn't feel anything for about 30 minutes, and then I actually started to feel anxious, and they were in the other room talking, so I called out and they came in, and I told Dr. Weitzel that I felt anxious, and I felt like my heart was racing. And there is an amphetamine component to MDMA, so I think maybe that's what was happening, and that was making me feel anxious. But he took my pulse, he said it was fine, and that feeling passed pretty quickly. And I think as the serotonin and the dopamine and the other neurotransmitters were being released, then that helped me to calm down. And then he asked me if there was something that I remembered that I wanted to talk about. So I just started talking about the first thing that came to mind. That was something traumatic that happened. I won't go into all that. But I actually ended up talking about that and a number of other things for, I think, almost 3 hours. And it was interesting that it was like I was watching a movie. It was my story and I was telling, but I didn't have any fear or anxiety or any negative emotion attached to it. So it was a very neutral feeling. And normally he would give me a booster dose at about 45 minutes in, but I guess because I was already talking and a lot was going on, I didn't end up getting the additional booster dose of 75 milligrams, I think, until about 2.5 hours in. So my experience lasted throughout, into the early afternoon. And I did have some sweating, and I felt, and it was like my teeth were chattering a little bit. And I've never used this medicine, outside of the setting, so I don't know if that's typical or not typical. It wasn't necessarily uncomfortable. It was just something that I noticed that was different. And and it's hard to explain. It was like, I feel like when there's trauma, things get packed away in your brain and stuck and not really maybe necessarily put in the right place. And then there can be some distorted beliefs and then some patterns that come out of that. And it felt like I was able to just kind of take it all out in a calm way and take a look at it and say, okay, I don't want this anymore, or this doesn't belong to me, and then slowly kind of start to pack everything back. And I think for me that the integration period, which is now what I'm in, will be, kind of slowly putting things back where I want them to be. And I'm a little anxious about that aspect. I want to get the most out of it and to integrate fully the experience, and I plan on working with an integration therapist. The other thing that was really powerful for me was that part of my trauma was that I was very alone when the trauma was happening, and to be able to go and revisit that in a calm way with a support around me, with Robert and with Brittany and with Kim, I didn't feel alone. And so it was like I was able to go back there with people who cared about me, and that in and of itself was very healing. So with the MAPS protocol, one would have 3 sessions about a month apart, and then counseling every week. So I may or may not need additional sessions. I'll see, how it goes. And I certainly didn't talk about everything that had happened, but I talked about the things that came to mind in the moment, and just trusted that those were the right things for me to talk about. So I'm excited to continue to receive the benefits of this medicine, and about the study that's being done, and about how this is going to be available, and just the dramatic improvement that people can have in their lives when they have a way to process the trauma and to change some of those beliefs and patterns, and really move past it. So, thanks for listening.